conducted in the COVID-19 active areas. And patients with cough, fever and respiratory problems are being tracked. The officials also ensuring that these patients are not suffering from coronavirus. And efforts in the non-spot 207 districts, that is to see that they do not slip into the hotspot districts. And the low-risk areas to also have cluster containment strategy. No community transmission though has been reported as yet. In fact, also the recovery of patients from COVID-19 cases has gone up. The rate of recovered patients now stands at 11.4%. The Cabinet Secretary also, remember, held a meeting with the officials of the state government and districts through video conferencing. And talking of the all India figures, the total number of positive cases stands at 11,933. Out of these, 10,197 cases are active. 1,343 have been cured or discharged, and there have been 392 fatalities so far. Union Health Minister Dr. Harshvardhan held a high-level meeting with the World Health Organization officials through video conferencing on the measures to fight the COVID-19 infection. Later, the minister also held a press conference and said the situation in the country is under control and India is in a better position than the rest of the world.
Our incidence is per million the lowest in the whole world. It ranges between 4 to 8. At different times it has ranged like that. Although for many of these countries it is in 2,000, 2,000, 3,000, 1,000, like that. Right now we are quite well placed in the sense that we know our enemy. We also know where our enemy is. And the talk about these hotspots is, I think I must congratulate our surveillance people, our IDSP people, our WHO people, all those who are involved in this, and particularly all our state governments, that we have been able to pinpoint where the virus is right now.
The Union Finance Minister Nirmala Sitharaman participated in the virtual session of the second G20 Finance Ministers and the Central Bank Governors meeting under the Saudi Arabian presidency on Wednesday to discuss the global economic outlook amid evolving COVID-19 pandemic crisis. India has disbursed financial assistance amounting to $3.9 billion to more than 320 million people. Policy measures undertaken by the Government of India, the Reserve Bank of India and other regulators have helped defreeze the market and catalyze the credit flows. Also, the G20 preparing an action plan to safeguard people's jobs and incomes, restoring confidence, preserving financial stability, also reviving growth, providing help to countries needing assistance, coordinating on the public health and financial measures, and minimizing disruption to the global supply chain. And also, in fact, efforts on for the global community, hopes being expressed to overcome this crisis soon. And the minister also said that the lessons learned will enable us to develop prudent policy measures to combat any such crisis in the future. The finance officials from the group of 20 major economies agreed to suspend the debt service payments for the world's poorest countries through the end of the year, a move quickly matched by a group of hundreds of private creditors. The decision was taken at a virtual conference. The actions to freeze both principal payments, repayments and interest payments will free up to more than $20 billion for the countries to spend on improving their health systems and fighting the coronavirus pandemic. The World Bank Group President David Malpass and the IMF Managing Director Kristalina Georgieva have welcomed the decision of the G20 group of leading economies to suspend the repayment of the official bilateral credit of the poor countries. In a joint statement, they said that this is a powerful, fast-acting initiative that will do much to safeguard the lives and the livelihoods of millions of the most vulnerable people. They further added that the World Bank Group and the IMF will move quickly to respond to the G20's request to support this action by working closely with these countries in ways that make the best use of this vital lifeline. In response to the media query on a tweet on Wednesday by the United States Commission on International Religious Freedom on India, the official spokesperson Anurag Shrivastava said that the Commission must stop adding religious color to India's national goal of fighting the coronavirus pandemic. He further dismissed the Commission's claim that COVID-19 patients in Ahmedabad hospital segregated based on religious identity. He also ensured that there is no segregation of COVID-19 patients at the civil hospital in Ahmedabad on religious lines. He's also accused the Commission spreading misguided reports on professional medical protocols followed to deal with COVID-19 in India. The World Health Organization chief has said that he regretted US President Donald Trump's decision to pull funding for the agency and called for the world unity to fight the coronavirus pandemic. Addressing a news conference, the WHO chief said that the World Health Organization is reviewing the impact on its work of any withdrawal of the US funding and would work with the partners to fill any gaps to ensure its work continues uninterrupted. The American Medical Association called on the US President Donald Trump to reconsider his decision to temporarily halt funding to the World Health Organization over its handling of the coronavirus pandemic. Trump said that the WHO had failed in its basic duty and it must be held accountable. He said it promoted China's disinformation about the virus that likely led to a wider outbreak. In a statement, Dr. Patrice Harris called it a dangerous step in the wrong direction that will not make defeating COVID-19 easier and urged Donald Trump to reconsider. US President Donald Trump will make an announcement on the guidelines for reopening parts of the country amid the coronavirus pandemic. In a White House briefing on Wednesday, Trump said that the data suggests the US has passed its peak of new cases and such encouraging developments allow